Assalamualaikum and hi, my name is Nidnor Ain binti Nipar, match number 1181277, and I will present to you about abstract and problem statement on child abuse. So yeah, let's go. Children are part of a society that will connect to the development of the country and human resource assets in the future. Therefore, the government is very concerned about the well-being and safety of children. However, society is now often shocked by various news related to child abuse. Cases of neglect and negligence of children by parents or guardians are on the rise in Malaysia despite the existence of legal provisions governing it. The incident seems to have no way to deal with it, as it is rare to hear this group brought to justice. Almost every day, Malaysian newspapers feature cases of abuse involving children. A more serious issue is the decline of family institutions, which invites various impacts that hinder in producing a prosperous and caring society.
Referring to the Child Act 2001, Section 2 of Act 611, child is defined as a person under the age of 18. Pursuant to Section 17, brackets of 2, a child is said to have been physically abused if there is a significant injury and can be seen in any part of the child's body. Child abuse is no longer a new phenomenon. In fact, it happens worldwide. The sharp increase in the child abuse cases raises concerns among the public, especially parents, because there are cases of child abuse causing serious injuries, defects, and death. On the last few days, the 7-year-old dead Zubaidi Ame Kushairi Abdul Malik, who was found dead on Friday, believed to be abused by his mother and his stepfather, to lead the hearts of all Malaysians. The tragic death was also voiced by local celebrities, including the Hot FM presenter Haziq Husni, 31, who expressed his anger against the unfortunate mothers through the Instagram site. According to Haziq, the child's biological mother should not recapture Ame if she has no intention of raising it. Statistical data child abuse case. A total of 5,578 in 2018, while 2019 amounted to 6,061, and in 2020 to September amounted to 6,865 cases. Cases of physical abuse in 2018 amounted to 1,073, while 1,571 cases in 2019. And in 2020, the total is 1,120 cases were recorded until September by Sinar Harian 40 September 2020.
My name is Nur Zafira binti Sari, matric numbers 1181252. I will be presenting about the objective, goals, outcome, and planned project description of this project proposal. This project proposal aims to understand the impact of domestic violence on children who are victims of such violence, identify responses and interventions to this violence by upholding the rights of the child, and research the current legal framework in the context of the child's life experience to identify existing deficiencies and recommend programs to address the problem. The purpose of the program recommended is to control the case of child abuse that are increasing day by day. The objective of this project proposal is firstly, to identify the factors that lead to the problem of child abuse in the troubled family. Secondly, to provide program of counseling treatment such as rehabilitation service and mental development for parents and children who are the victims of tutor, neglect, abuse, and domestic violence. Thirdly, to identify victims of violence and areas considered to be high risk and provide campaign to prevent transmission of child abuse case. Fourthly, to enhance the cooperation between Hospital University, Hospital Kuala Lumpur, NGOs, and Social Welfare Department in providing safety and education to ensure the well-being and welfare of children. Fifthly, to improve training in this program to all parties dealing with children to have sufficient knowledge, qualifications, and skills and be positive in handling case of abuse, neglect, and violence against children. The goals of this project proposal is to provide appropriate programs to strengthen children's physical and mental development and protect them from any domestic violence. The filling of the program is guided by the strength of the existing programs by introducing appropriate programs to prevent abuse, neglect, and violence against children. Program participants are based on the children who are victims of abuse and also their parents. Working in collaboration with Hospital University, Hospital Kuala Lumpur, NGOs, and Social Welfare Department, and also Counseling Service, determined that as a result of these programs, we expect it can bring positive impact on victims of child abuse and also their parents as well. Therefore, the outcomes of the implementation of these programs is to improve child mental health and reduce trauma, to increase involvement of community agencies in child sexual abuse cases, to increase child protection rates and reduce rates of self-report child physical abuse, to increase access of victims to medical and mental health service, to reduce re-victimization rates and improve mental health status among victims, to increase parental knowledge of child development and increase use of positive parenting strategies.
Overall of the problem that arise from the case of child abuse in Malaysia, we plan of some project that refer to child abuse prevention programs that specify to the children who are the victim of domestic abuse. Child abuse prevention programs are divided into 3 levels, namely primary, secondary, and tertiary levels. These programs have been modified and adapted to child abuse prevention and protection programs in Malaysia. A detailed description of child abuse prevention programs can be divided into 3 levels as follows.
Firstly is primary level prevention program. Primary prevention programs emphasize environmental problems that can lead to child abuse and neglect. The purpose of primary prevention programs is to identify as many factors that affect child abuse. After identifying the problem, these target groups are given treatment and protection through socio-political action plans. One of the socio-political actions is the current court ruling against parents who are convicted of abusing their children. For counseling and attending parenting skills course as one form of punishment in addition to the current imprisonment. The program aims to provide appropriate advice and guidance to the parents involved as well as to prevent them from repeating indecent and irresponsible acts.
Secondly is secondary level prevention program. Secondary prevention programs can be implemented by identifying victims of violence and areas considered to be high risk. The target groups at this stage are high-risk groups such as children and parents or violence abusers. High-risk children are disabled, hyperactive, inactive, and so on. On the other hand, parents or abusers at high risk are mentally ill, addicted, and intoxicated. The preventive program identified is to seek the advice of a family therapist in the hospital near where they live. The condition of the house and living environment is also a source of child abuse. For example, the high-risk areas such as the village areas of Kampung Sungai Kayu Ara, Kampung Medan, and several quarter areas around Petaling Jaya and Kuala Lumpur. The activity center should be located in high-risk areas, and it should be easier for victims and parents to participate and form a more positive personality. Thirdly is tertiary level prevention program. A tertiary prevention program is a community-wide program. The program is based on hospitals, formal institutions or informal institutions. Hospital University or Hospital Kuala Lumpur need to hold seminars, forums and workshops on case of child abuse from time to time. It will benefit and also educating physicians and other members to be more sensitive on the issues of child abuse. In addition to seminars and forums, motivational classes for doctors, nurses, and medical welfare officers should be held because in this way they can deal with abuse cases more objectively and understand the behavior of children and abuse effectively. Therefore, the Social Welfare Department also has established child activity centers in 14 states, and this will be added as a measure to help overcome social problems, as well as help parents and children in trouble in the country. Children who are victims of serious abuse are usually placed in social welfare institutions. This action is legally legitimate as stated in Section 5(1) of the Children and Young People Act 1947. The purpose of these children being placed in this institution is to give parents a chance and time to understand their behaviors and to embrace the child again. During this time, the protection team will also visit the family and provide counseling service from time to time. Counseling services plays a push for parents to raise awareness of how important children's rights are to them. This is because counseling in the context of Islam is a concept of help service based on devotion ubudiyah to Allah and guided by the Quran and Sunnah. Both of these sources are used as a guide to mankind throughout the age who are able to give blessings as well as healers from God to human beings. Islamic counseling is not only able to solve problems, but it is also one of the help service that covers all aspects of human life based on the scope that has been outlined by Islam. Da'wah in the context of counseling is one way to discipline oneself and talk about the physics aspect in human beings.
I am Nur Safiqah binti Aziz, matric number 1181276. I would like to present about evaluation. Child abuse and violence are of global concern and have long been unresolved issues. Our organization decided to establish this project with goals to defend and rear the victim's life. Thus, this PERSIST project measures for the success through the questionnaire to obtain the participants' feedback. Based on the measurement used, the set of performance goals for each kind of evaluation, approximately 94% people will gain new knowledge through this project. Organizational capability. The organization establishment. Our organizational was established specially to focus on children empowerment. Main focus on this new project. This new project aims to help encourage the children to be brave and courageous to fight for their rights. collaboration with particular partner organization. In this case, we are see eye to eye with the Social Welfare Department to collaborate in solving this issue. The organization's expertization. We are totally different from others, which we are very committed to ensure this project accomplish the main goals. Before this, we used to undertake similar programs such as care for autism children and together with children with disabilities to centralize their rights as other children entitled. In our previous discussion with the Social Welfare Department, they will focus on serve the delivery of welfare services towards the participants persistently until they recover mentally and physically. We are concerned to focus on the motivational program, the participants' progress, and appraisal towards this project. This well-known social welfare department stands with empowering people in need towards the social well-being, which have similar focus with our organization, tend to build a better society in future.
Hi, my name is Uminora Sikin Benti Rosli, matric number 1181283. Personnel and staffing pattern. This project has collaborated with JKM, Child Welfare Care Centre, University Hospital and Kuala Lumpur Hospital to curb the problem of child abuse among families. Our project has also collaborated with counselling centres to provide counselling and guidance service. We choose to work hand in hand with them to make it easier for us to help deal with this child abuse problem because they play a very big role and have a great experience in dealing with problems like this. The management and system of JKM in solving the people's problem is very good and systematic. Their social work case management system also takes into account and approach problem solving involving 5 key elements arranged by level. Every level and element has several different work process. For each work process includes activities, knowledge and skill that guide the caseworkers in performing a task. The parties we are involved in this project are ready to help and venture into this community and Dawah project. Continuation and sustainability. This motivational child abuse program will be carried out continuously by providing ongoing counseling services and treatment once every 3 months. This project is ongoing and will be held motivational program child abuse 2.0 in the future to curb the problem that is increasing day by day. We and some potential NGOs such as JKM and counseling centers will provide treatment assistance for children and provide counseling guidance in stages and continuously to reduce and curb the problem of child abuse. At the same time, we use the funds we receive to fund the cost of counseling and treatment sessions for children. These counseling and treatment sessions will continue to reduce the increase in cases of child abuse. Every fund we receive is for the full cost of financing this project. This program is very helpful in raising awareness among families and communities on the equality of children from any forms of discrimination and strengthen existing programs as well as introduce appropriate programs to prevent abuse of children. We will better understand and improve our project for the future so that more benefit can be given to the community, especially among families.